Good morning, good afternoon, good evening, depending on where you are joining us from in the world today. My name is Ivory Clark, and I'm the director of the National Academy of Medicine Culture of Health program. My colleagues and I are delighted that you are joining us for a virtual stakeholder meeting on measuring impact to achieve health equity. We have an engaging number of panelists who will be sharing their knowledge and experiences with us as we continue to work to advance health equity and build a culture of health. Next slide, please. As we open today, I would like to provide a moment of pause to recognize the voices and efforts we stand upon and are building from as we work to advance health equity for all people in the United States, many of whom have been and at times remain invisible. As a point of reflection, I invite you to go to the website native-land.ca to identify the traditional territory you are joining us from today. I'm based in Washington, D.C., in the Washington, D.C. area on the ancestral lands of the Piscataway people. The native land map does not represent or intend to represent official or legal boundaries of any indigenous nations and recognizes that it is not perfect. This is a work in progress with contributions from the community. As we work via the Culture of Health program to elevate the diversity of evidence from engaging with communities, I encourage us each to acknowledge the richness of cultures and perspectives that are foundational in building a culture of health. Next slide, please. Before we begin the meeting, I would like to share some housekeeping items with everyone. Our meeting today is being hosted over Zoom and it is being recorded. The chat feature and Q&A function are both enabled. If you have any technical issues, please use the chat feature to let Jessica Covington know. Please use the Q&A function for questions only. It will be open for the duration of the webinar. Please feel free to ask questions throughout each of our sessions. We'll have an audience Q&A at the end of each session. Please note, we will not check the chat for questions to the panelists. If you are following us on social media, we will be live tweeting both days of our meeting, and our Twitter handle, is @VNAMedicine. You can follow our highlights of each session or join yourself on Twitter with the hashtag #PromoteHealthEquity. Finally, as I said, this meeting will be recorded and the session presentations will be posted in the coming weeks at the conclusion of our 2 days. A summary of key meeting takeaways will also be shared at that time. Next slide, please. I'd like to thank the Culture of Health Program Advisory Committee members for their continued guidance and insight to the program. I would also like to thank my colleagues Jessica Covington, Samantha Phillips, Julie Tarrant, and Michael Zhu for their invaluable behind-the-scenes work. I'll turn it over to Dr. Antonia Villarruel, who is the chair of the Culture of Health Program Advisory Committee, to introduce herself and formally open our meeting. Tony, over to you.
Great, thanks so much, Ivory. And let me join Ivory in welcoming you all to this exciting 2-day stakeholder meeting. As Ivory said, I'm Antonia Villarruel, and in my day job, I'm Dean of the School of Nursing at the University of Pennsylvania. I'm a member of the National Academy and chair of the Culture of Health Advisory Group, a group that I am privileged to be a part of. So let me tell you a little bit about the Culture of Health program at the National Academies. It began in June of 2015 as a collaborative partnership between the Robert Wood Johnson Foundation and the National Academy of Medicine to operationalize the vision for building a culture of health that is grounded in the evidence, multi-sectorial in its collaboration, and engages the range of stakeholders necessary to have real and meaningful and sustainable change. NAM is and has always been committed to health equity, and our partnership with RWJ has been focused on this broad system approach for years. This partnership has led to incredible growth at the National Academies, and together with RWJ, it has well prepared us to deal with the challenges that we all confronted in 2020 with the dual pandemics. The mission of the Culture of Health program is to identify strategies to create and sustain conditions that support equitable good health for everyone living in the United States. The program aims to create a shared understanding that health is more than disease treatment and what occurs within the clinical walls. We are all familiar with the definition of a culture of health, but just to ground us, a culture of health exists when people recognize that health is linked not only to access to care, but to the environments in which we live, learn, work, play, worship, and age. And it's influenced by the social determinants of health, which include education, employment, housing, transportation, the social, physical environments, public safety, income and wealth, and health systems and services. The 2017 report, Communities in Action, Pathways to Health Equity by our program has been a basis for the work that has led us in the Culture of Health program here at the academies. And it identifies several root causes of inequity, informing the program's intentional focus on two drivers of inequity: structural racism and the unequal allocation of power and resources. There has been increased discussion about each of these root causes across the nation. The increased awareness and openness to these inequities presents us a unique opportunity for accelerated change to the systems that create and sustain inequities. It's time for us to move beyond discussion of the problem to identify and amplify strategies to disrupt systemic pathways to inequity, to approach the redesign of systems with humility and in partnership with communities most impacted, and to build relationships that drive sustainable change. Our meeting over the course of today and tomorrow will focus on examining the key elements, considerations, and methods for efforts to advance health equity, to measure and evaluate the impact of their work, both directly and toward larger system changes. Day one is going to focus on level setting to highlight the existing evidence base, and presentations and discussions will explore what we know about how to measure and evaluate impact toward health equity. The day's sessions will establish the role evaluation plays within the broader ecosystems and ecosystems as we advance health equity. And secondly, the importance of value frameworks and cultural humility in adapting evidence-based practices for diverse communities. And finally, how planning for dissemination of evaluation findings to key stakeholders, including the communities intended to benefit from the program, is critical in the evaluation design. Each main session will include panel presentations, followed by a group discussion and audience Q&A. Members of the Culture of Health Advisory Program Advisory Committee will moderate the sessions and discussions. Day two is going to be devoted to examining models for evaluating impact towards health equity, turning over the stage to case studies of evaluations, approaches, methods, and findings from efforts to advance health equity from diverse sectors and locations in the U.S. So on behalf of myself, my fellow advisory committee members, and the NAM Culture of Health program staff, I welcome you to our meeting and I look forward to our discussions.